respected doctors, my colleagues, medical students, and paramedical persons, welcome to the ECG reader group. This is the first specialized wing of BD physician. And I am Dr.Bikash. I am cardiologist, presently working as medical director and chief of the cardiac services in Gautam Buddha International Cardiac Hospital, Nepal. I did my cardiology course, that is EMD cardiology from PSMMU, Bangladesh in 2009. We'll be talking about ECG, and the medium of the instruction will be in English and Bangla. Whatever I speak in Bangla will be repeated in English also. So the topic is ECG. We'll talk about this is ECG Basic. We'll not talk about the advanced things. We'll talk about the basics. We'll start the ABCD of ECG, and this will be covered in 5 parts. Every part consists of the 20 to 25 minutes video lecture. So first we'll start with the ECG Basic Part 1. ECG Basic Part 1. What does the ECG means? ECG means E means electrocardiography. So it is the recording of electrical activity of cardiac muscle, that is heart muscle, and graphy is you would represent in the graph. So what are the electrical activities of the cardiac muscle, how it is represented in the graph. So before we start the things, so we should know the graph and the calibration of the graph. So graph, what is graph? That is the graph what we use in the school. আমরা স্কুলে যে গ্রাফ পেপার ইউজ করছি সেইটাই গ্রাফ পেপার এখানে ইউজ করব। গ্রাফ পেপার আমরা বললে আমাদের মনে আসে এক্স অ্যাক্সিস থাকবে, ওয়াই অ্যাক্সিস থাকবে। So whatever we use in the school, graph paper we used in school, that is same graph paper used here, and that graph paper consists of the x-axis and y-axis. So let us see the graph. Calibration of graph. 1, 2, 3, 4, and here also 1, 2, 3, 4. So this is x-axis, this is y-axis. One small square in the x-axis. Normally x-axis represents the time and y-axis represents millivolt. Millivolt is one small square in the x-axis. This is 0.04 second. And y in the one small square in the y-axis, it represents 1 millimeter or 0.1 millivolt. So this is the calibration in the x-axis and y-axis. So how we measure this electrical activity? We measure the electrical activity of the heart by putting the electrodes over the chest wall surface and arms. So there are, all of us know, there are 2 types of to measure this electrical activity. We need 2 types of electrodes. 2 types of electrodes or leads. One is chest lead, another is arm leads. Arm leads. Chest leads are again labeled as P1 to P6. chest leads are B1 to B6. Among the B1 and B2, these leads look at the heart horizontally from the right side. And B3 and B4, they look at the heart from septum sides. B5 and B6 look at the heart from left lateral side. Overall, these chest leads look at the heart from horizontal plane. Chest leads are also labeled as C1 to C6 accordingly. And arm leads, they can be again categorized as standard, bipolar leads, and augmented leads. Standard bipolar leads are lead 1, lead 2, and lead 3. And augmented leads are AVR. A stands for augmented, AVL and AVL. So two types of leads are used for recording the electrical activity of the heart or ECG. Those are chest lead or arm lead. Chest lead B1 to B6 and arm lead standard bipolar leads or unipolar leads. Standard leads can be lead 1, 2, 3 and augmented leads are AVR, AVL and AVF. So all of us know that heart muscle consists of atrium and ventricles, and electrical activity atrium or muscle consists of atrium and ventricles. So electrical activity means action potential. Action potential consists of the, all of us know that action potential consists of depolarization and repolarization. So electrical activity measures this depolarization and repolarization of the atrium and ventricles. And these activity are look like by the these are represented by the some waves. The normal, how does the normal ECG look like? Normal ECG. P wave, QRS complex and T wave. So P wave is represents atrial depolarization. Atrial depolarization. Depolarization. QRS complex so QRS complex represents ventricular depolarization. QRS complex is ventricular depolarization, and T wave represents ventricular repolarization. So P wave is atrial depolarization, QRS complex is ventricular depolarization, and T wave is ventricular repolarization. Question প্রশ্ন আসতে থাকতে পারে atrial depolarization তো আছে, atrial repolarization কোথায় গেছে? ECG তে আমরা মনে করব atrial repolarization is buried within the QRS complex. That is to say, atrial repolarization occurs at the same time as ventricular repolarization. Question আর জিজ্ঞাসায় আরেকটা থাকতে পারবে atrial wave ছোট কেন, ventricular wave বড় কেন? Atrial wave is thinner, atrial wave thin আছে, ventricular wave is thick আছে, সেজন্য atrial wave is smaller, ventricular wave bigger. I mean to say, atrial muscle is thin, ventricular muscle is thick. So the atrial wave is smaller and ventricular wave is bigger. So these are the normal waves in the ECG. We should know some normal intervals also. Normal interval like PR interval and QT interval. PR interval and QT interval. Interval means actually interval means time. PR interval, it is the time period from beginning of P wave to beginning of QRS complex. This is PR interval. PR interval is beginning of it starts from the beginning of P wave up to the beginning of the QRS complex. PR interval. Normally this is PR interval. And another is we should know QT interval. QT interval is from beginning of QRS interval to the end of the T wave. Or also we can say it starts from the end of the PR interval up to the end of T wave. This is QT interval. QT. These are the normal two intervals we will study accordingly. Now we should know ST segment. ST segment, this is the segment from end of S wave to the beginning of T wave. This portion is the ST segment. This ST segment starts from the beginning, end of the S wave and up to the T of the beginning of the T wave. This is ST segment. And during this ST segment, there is no conduction of the electrical activity from the atrium to the ventricles. Now after that we should know the TP segment. So this is another P, QRS and T wave. So TP segment is from beginning of T wave to beginning of the next P wave. This is another P, QRS, T. This is P, QRS, T wave. Okay, beginning of T wave to beginning of the P wave is called TP segment. TP segment. Actually, this TP segment is also called isoelectric line. TP segment के isoelectric line बोला है. আমরা টিপি সেগমেন্টের সাথে কম্পেয়ার করে এসটি এলিভেশন আর পিআর সেগমেন্ট ডিপ্রেশন আর এসটি ডিপ্রেশন কম্পেয়ার করে আমরা বলতে পারি we tell ST segment, we compare ST segment or PR segment according to the TP segment. TP segment is the this is isoelectric line for ECG. So we have just introduced what is ECG, then how the graph paper is calibrated accordingly in the x-axis and y-axis, then what are the normal waves, PQ, RST waves, P waves, what does P wave represent, QRS represent and T wave represent. Similarly, what are the intervals like PR interval, ST and segments like ST segment, QT segment, TP segment we have introduced. Now what is the time duration in cardiac cycle? One cardiac cycle time is the summation of time of PR interval plus QT interval. So one cardiac cycle is the summation of the time of PR interval and QT interval. This is some of the introduction of the graph and some of the introduction of the normal physiological introduction of the PQ RST wave and the intervals. And in the ECG Basic Part 1 class, now I will be talking about P wave. P wave এর সম্বন্ধে আমরা আলোচনা করব। নরমাল P wave দেখতে কেমন, নরমাল P wave এর সাইজ শেপ কত, নরমাল P wave এর টাইম ডিউরেশন কত, ওর নর্মাল থেকে ডেভিয়েশন হলে কি কি অ্যাবনর্মালিটি থাকতে পারে, আমরা ইসিজি বেসিক পার্ট 1 এ আমরা আলোচনা করব। We'll talk about the P wave. Normally P wave is positive in all the leads. It look like this, and in the x-axis its duration is 2.5 square. Time duration is up to the 2.5 square. It is upright in all the leads except normally it is inverted in ABR. Inverted, upright all the leads. It is upright in all leads. All leads. Normally it is inverted in ABR and it is biphasic in P1. This is the normal P wave. It is upright in all the leads. Normally it is inverted in AVR and it is biphasic in P1. And normal its time duration in the x-axis 2.5 square. One small square is 0.04 second up to 2.5 up to that is 0.10 second. Up to 0.10 second is the normal time duration of the P wave. Similarly, if we talk about this height in the y-axis, here also 2.5 small square. One small square is 1 millivolt, so 1 millimeter. 2.5 small square is up to 2.5 millimeter. 2.5 millimeter is normal and time duration is up to 0.10 second is normal. Then what abnormality can occur in the P wave? And normally it is convex upward. It is normally, it looks like this, convex upward in all leads except in ADR where it is inverted. Sometimes there is P waves are absent. Sometimes P wave are absent P waves. There are so many conditions in which P wave may be absent. Number 1, atrial fibrillation. P wave may be absent in atrial fibrillation. P wave may be absent in sinoatrial block. P wave may be absent in sinus arrest. P wave may be absent in hyperkalemia. So in these conditions, P wave absent P wave আমরা নাও দেখতে পারি. We may not visualize the P wave. না দেখতে পারি, that means it is not visualized. So in these conditions, P wave may not be visualized. Atrial fibrillation, sinoatrial block, sinus arrest, and hyperkalemia. Atrial fibrillation, QRS complex is irregular. How can we differentiate? QRS complex irregular. QRS complex irregular থাকবে। এসসি ব্লক আর সাইনাস অ্যারেস্টে কি রকম চেহারা থাকবে, ইসিজি দেখতে ফেস কেমন? How does the ECG face of the atrial SA block and sinus arrest occur? In sinus arrest, the ECG will show the ECG. In sinus node arrest, in sinus arrest, there is some absent P waves in this segment. There will P wave is absent. P waves absent, and there will be some pause will be there. P wave will be absent, and after some duration, there will be narrow QRS complex. QRS complex without preceding P wave. Preceding P wave. So the normal QRS complex is there, QRS complex is there, there is sinus arrest, there is no wave. And after some duration, QRS complex will arise, but there will be, there is no preceding P wave. Narrow QRS complex আছে, P wave 9. This is sinus arrest. So we can distinguish the sinus arrest from sinoatrial block. Sinoatrial block. Here also there is no P wave, but after some duration, one P wave, narrow QRS complex arises, but there is preceding P wave. Preceding P wave is there. So this is sinoatrial block. So here is no P wave. These are the cause of the P wave. Now other abnormality that can occur in the P wave is abnormal shaped P wave. All of us know that sometimes in the P wave abnormal shape P wave that can occur in many conditions like atrial flutter, atrial fibrillation, P pulmonale, and P mitral. In atrial flutter, ECG phase is very typical. एकटाई condition যেখানে P wave looks like sawtooth. Sawtooth appearance. Atrial flutter দেখতে কেমন লাগে? এখানে sawtooth appearance দেখা যায়। sawtooth appearance ইসিতে একটাই কন্ডিশন যেখানে sawtooth appearance, অন্য ডিজিজে sawtooth appearance দেখা যায় না। I mean to say there is sawtooth appearance is only seen in the atrial flutter. The ECG phase will be like that. In atrial fibrillation, now come to the atrial fibrillation. By ECG, we know that all of that in atrial fibrillation, ventricular rate is irregular. So, ventricular rate is irregular, but by ECG, atrial fibrillation be classified as coarse atrial fibrillation by ECG. Atrial fibrillation can be classified as fine atrial fibrillation, coarse atrial fibrillation, and discernible. Fine atrial fibrillation, coarse atrial fibrillation, and discernible atrial fibrillation. In fine atrial fibrillation, the fibrillatory P wave is fine, means that is small, that is only up to the 1 millimeter. And in coarse atrial fibrillation, the height of the fibrillatory P wave, it is more than 1 millimeter. And discernible atrial fibrillation, here we cannot see the that is fibrillatory P wave. P wave is not visualized, only QRS complex is irregular. Now we'll be talking about the P pulmonale. P pulmonale is visualized in lead 2 and P1. In the lead 2, it will be, the shape will be this like peaked, and this is also called Himalayan P wave. It will be just like, look like the mountain, and its height is more than 2.5 small square, that is to say more than 2.5 millimeter. In the lead 1, and in the lead 2, its phase will be like that. In lead P1, P pulmonale looks like the initial component of the P pulmonale is greater than the terminal negative component. So this is P pulmonale in P1. So we looked at lead 2 and P1. In lead 2, it will be peaked, and lead P1, initial component of the P wave is larger than the terminal negative component. This is P pulmonale. P pulmonale occurs in so many conditions which causes right atrial enlargement, like pulmonary hypertension, tricuspid valvular disease, and in other conditions that may cause the pulmonary hypertension. Another abnormality of the P wave is P mitral. In the P mitral, this is also better visualized in lead 2 and P1. In the lead 2, it will look like the bifid P wave, also seen as M-shaped. And in B1, lead B1, the terminal negative component of the P wave is larger than the initial positive component. So P mitrally also called biped P wave. Biped P wave. Visualize in lead 2 and P1. Lead 1 looks like M-shaped and it is wide, that is more than 2.5 small square, that is more than 10, 0.10, more than 0.10 second. And in the lead P1, negative component is larger than the terminal negative component is larger than the positive component. This is P mitrally, and conditions which can cause the P mitrally is mitral valvular disease like the mitral stenosis, and it also occurs due to that any condition that leads to the left atrial enlargement like core-tie atriatum, ball valve thrombus, and left atrial myxoma. In these conditions also there may be P mitrally. And another abnormality of the P wave is inverted P wave. Inverted P wave. So P wave will look like inverted P wave. The inverted P wave normally occurs in lead AVR. And it may occur as a electrode misplacement. Electrode misplacement. আমরা রাইট হ্যান্ডে লিড লেফট হ্যান্ডে রাখি আর লেফট হ্যান্ডে লিড রাইট হ্যান্ডে রাখলাম আর ইসিজি করলাম ইলেকট্রোড inverted P wave aspect. That is to say, I mean to say, if we put the reverse the arm lead and do the ECG, P wave will be inverted. And another condition that can produce the inverted P wave is dextrocardia. Dextrocardia. So this is all about the normal P wave and abnormal P wave. Any abnormality in the shape, abnormality in the like the inverted P wave, and we have discussed everything about the P wave and also the absent P wave. This is all about the P wave, and with this information we come to the end of ECG Basic Part 1.